If you could you tell us a little bit about the reason you came to see Dr. Barbanel and some of the problems that you were experiencing before you did come to see him?
Well, I had experienced problems all my life with my teeth. I think probably with my baby teeth, I probably had problems because they just never were good. And besides that, I had had a lifelong fear of dentists because sometimes dentists hurt you, and I didn't like pain. And so my parents used to make me go to a dentist, of course.
Sure.
And then when I grew up and was an adult and could do what I wanted, I only went when it was absolutely necessary, when a tooth had to come out or something. And I think in my 30s or something like that, I decided I'd better go to a dentist regularly because I was probably going to lose them if I didn't. So I went, but not regularly, and I think just intermittently until finally, shortly before I came to see Dr. Barbanel, my dentist then said, "I don't think I can save your teeth." And I'd been coming in for cleaning, periodically every 3 months and whatever dental work needed done. And he said, "I think you need to see a periodontist." And he gave me a name to go see. And so I told my daughter, I said, well, this is just one more thing, and I had already had gum surgery 2 years or 3 years before, something like that. I'm not going to go through that again, and so I'm just going to have them pulled out. They never were any good anyway, and so I'll be glad to be rid of them.
So then you were faced with the prospect of losing your teeth.
Yes, definitely. I was almost resigned to it.
Mm-hmm.
And so my daughter said, well, would you please just see Dr. Barbanel, and because she had recently discovered him. And I said, all right, I see him, but I won't like him.
Well, hopefully he proved you wrong.
Yes, he did.
Tell us a little bit about what Dr. Barbanel told you he might be able to do for you.
He was very frank about it. He said he didn't know. He wasn't sure because my teeth were very mobile, and
so they were actually moving in the
Oh, yes. And I had had trouble eating for quite a while. I ate only soft foods.
So were the teeth that mobile in your mouth that you had difficulty eating?
Yes,
with your natural teeth?
I paid great attention to what I ate. And besides that, I was very sensitive to heat and cold. I had to really watch what temperature food was before I put it in my mouth because it gave me quite a shock if it was either hot or cold. And of course that was a factor with the dentist too, because it made the teeth extra sensitive, I think, and so that was what made it extra unpleasant. But after he did examine me, he said he felt like he could save the teeth, and I said, go to it.
Great. So now we have dental implants. Look at this smile. Look at this. The camera does not lie. When we first met you, you came in here beaming. You were just, it seems like you are so pleased with your implants. Tell us now about your lifestyle with your dental implants.
Well, I don't know exactly what you mean by my lifestyle with my dental.
How's it changed? You're obviously eating differently.
Oh, yes, absolutely. Yes, I can eat anything I want, steak, apples, corn on the cob. Anything. Maybe you can tell. And that is really, I can't describe it. It's really a great feeling.
Great.
And also the sensitivity to heat and cold is no longer there. And my teeth no longer hurt constantly like they did. Well, it wasn't constant, but it was practically constant. And I don't think about them. I think about them when I have to go have a cleaning.
Sure.
But even the cleaning doesn't hurt anymore. Mm-hmm. And that's what is so amazing to me. It not only improved the looks, but it just, I feel like I grew these teeth.
Great. Great. And you care for them just like your normal healthy teeth?
Better than I did. Mm-hmm. Much better. Mm-hmm. And I like to look at my teeth when I clean them too now, and I didn't before.
Right. You have a beautiful smile. We've already discussed that. You're a legal secretary, and obviously you deal with people on a daily basis.
Yes.
And the aesthetics and the cosmetic application that the implants have given you have to really be important.
Yes, it's very important. Now, I just went back to work after a 22-year absence, And
Did your new teeth have anything to do with you going back to work?
partially, I don't think I would have really wanted to if I had false teeth.
Wow.
I don't think I'd have been thrilled about it.
Great. So now you're back at work and you're dealing with people on a daily basis and you're probably smiling all day.
No, I'm not.
Okay. I'm being facetious.
Yeah. But yes, we have a very nice office and we smile a lot.
Good. Tell us about the cost of the procedure. You've obviously made an investment in yourself. Do you feel it's been money well spent, and too much money well spent for that matter?
I think it's really very economical considering that it changed my life, and it did change my life.